Which BP med gives patients that persistent dry cough they hate? 99% of students miss this on exams. Swipe to find out. It's the ACE inhibitors, lisinopril, enalapril, ramipril, the most commonly prescribed ones. ACE breaks down bradykinin. When you block ACE, bradykinin accumulates in the lungs and triggers that irritating dry cough. Hits 10 to 20% of patients, not dose-related, and more common in women. Mnemonic, ACE equals angiotensin cough every time. Management, just switch to an ARB like losartan or valsartan. Same BP control, no cough. Save this reel and follow for daily pharma facts.